Hello, thank you for joining us today on Matters of Substance. This is Carley, your host. If you've been a long-time listener, you may have noticed that Caitlin has not been on in a while. And that is sadly due to the fact that she is no longer with the Porter County Substance Abuse Council. She got her social work degree and master's program and has moved on since to go into the hospitals and help people out that way. And so we are so grateful for her to have been with us for so long and for her to have that opportunity to really follow her passion of helping people. So yeah, you'll be hearing me and Chris, or a combination of one of us as your host as we move forward throughout this podcast and throughout all of our episodes. So that aside, today we have Alyssa Zilz. Alyssa is with Mental Health America of Northwest Indiana, and she's the Porter County Program Director. Hi, Alyssa. How are you today?
I'm good. How are you?
Great. I appreciate you coming on and joining us.
Absolutely. Thanks for having me.
No problem. So we have been working side by side with Alyssa for over a year now on many of our different programs. She's a part of our coalition, and she coordinates a lot of really great programs here in Porter County that are accessible to our community members. Also, I'm sure you've probably heard of Mental Health America, because I believe it is a national program as well. And so if you're listening from anywhere outside of Indiana, I'm sure that you have heard of Mental Health America, and just know that there are probably programs that they provide to your area as well. And so if you're interested in finding out what you have access to, you can check out Mental Health America. I was on the website yesterday, but I don't remember the national one exactly. But I'm sure if you just type in Google Mental Health America, you'll find it.
I believe it's mentalhealthamerica.org.
Oh, perfect. So that's it. Just a .org after that.
Yes.
So Mental Health America is a really great organization, and Alyssa's here representing our Northwest Indiana chapter, and so we just appreciate it. So Alyssa, I wanted to give the listeners the opportunity to hear about what we have here in Porter County specifically that you are coordinating. The first thing I thought would be really beneficial to talk about is the new program that you have recently created and now have released and launched into our community. And that one is talks about smoke-free moms, or to help moms become smoke-free. So would you mind sharing a little bit about the process of how you created that program, the research that went into it, so that you know how that it'll be effective, and then what it is and how people can get connected to you if they'd like to utilize it?
Absolutely. So Smoke-Free Moms, a little bit of the backstory to that is the reason we're focusing on moms is because a few years ago, Lake and Porter County merged. So that's why we're Mental Health America of Northwest Indiana. And a majority of our Lake County programs focus on early childhood around 0 to 5. So when we created this program, it was kind of to coincide with programs that we already have. It came about because previously, before this program, we had Baby and Me Tobacco Free, which has been used across the country. We've had it for several years, but recently the Indiana State Department of Health chose to stop funding it. So we had to find an option. Were we going to continue to be in smoke cessation, or were we just going to let that service go? And then me and my coworker, Vicki Rainwater over in Lake County, who's been the main on our smoke cessation programs, we decided this is still something that's needed, and we'd like to try to see if we can kind of create something ourselves that we could still administer for those who need it, because even though numbers aren't what they used to be with smoking cessation, there are moms out there that still are, and it has many effects on their unborn child or even just children in the home with secondhand smoke. So when we did this, we kind of looked at what was currently being used. So we looked at Baby and Me Tobacco Free and kind of the model that they have, and we really liked a lot of it because it really focused into the deep things such as like the triggers and the coping mechanisms, because stopping smoking is so difficult. So there's got to be a lot of pieces to it. If I'm having withdrawals, what do I do about that? If I'm in a certain situation where I'm used to smoking, how do I handle that? So being able to identify their specific situations and needs and how we can help find solutions and action plans. So with that, the previous program, Baby Me Tobacco Free, was limited to mothers who were prenatal up to 36 weeks pregnant. So if they were 37 weeks or already had their baby, they were ineligible for this program entirely. And we found that we would see many moms that maybe in those last few weeks we found them, but it's too late, or they've maybe now had the baby at 6 months and now they want to quit smoking. And so how can we support them? So what we did is we took information from Baby and Me Tobacco Free, and we looked at Indiana Quitline and the resources and information that they had. And then smokefree.gov has so much information about smoking in particular, or specified towards women in general. So we took that and we revamped it and made something new, where now our smoke cessation program is available to anybody in Lake, Porter, Jasper, Pulaski, Benton, Stark. I might be missing some, but Region 2 of DCS is where we cover. I think it's a total of 8 counties. But anyways, what it will do is anybody 0 to 5. So prenatal mom up to having a child under 5. Again, so that kind of coincides as a starting place for us with our programs. So they would enroll. And when they enroll, depending on which track they're on, that's how we changed it. That's how we found the loophole, where we created a model that was for a mom who came in prenatally, because of course you're going to want to focus on the effects of your unborn child. How is this affecting their development and your pregnancy? But those that come in after, we still want to help them. So they don't need the prenatal piece, obviously, but there are so many pieces. So we have 2 different tracks depending on where they're at, as far as prenatal or postnatal. And the fun part about it is they get vouchers for being smoke-free. So how do we monitor if they're smoke-free? We have their Covita CO2 monitors, and they are for each individual client. They are able to blow into it once a month when we have our sessions, and it's able to be emailed to us. They can send me a screenshot. They can share it through text message, and it'll show where they fall on a range. And depending what their number is on that range will signify if they're smoke-free or not. And if they do fall in that small range and are smoke-free, then they get a $25 voucher to Walmart for diapers, wipes, baby items, because we understand being a parent is expensive. So we want to provide some sort of perk and incentive and reward for your hard efforts.
Oh, that's wonderful. I love that there is an incentive outside of health, because I think we all know, right? Like, oh, it's healthier not to smoke. We understand that, but in concept, but that doesn't mean that the dependence that's within us gets it, right? Like it's just a little hard to be like, I know I shouldn't because it's healthier. Just like if you don't make good eating choices, or you drink alcohol or whatever that looks like, we recognize and we know that maybe it's not the healthiest choice, but having additional reasons can sometimes help, right?
When you tie in that piece of how it affects their unborn child or the child in their home, because some parents feel that, oh, if I smoke in the car but I roll down the window, or if I smoke in one room, or even if I smoke outside, which is better, third-hand smoke is still a thing that not many people are aware of, but it affects our children. So finding that piece that connects with them. And a lot of times moms will resonate more with, this is potentially harming my child.
Yeah.
When you just focus on themselves, moms tend to, not always, but tend to push that aside.
I can totally understand that. I've worked with a lot of women in my life, and I see that as, when we talk about our babies, it makes it gives us a little more incentive.
Yes.
Although I do question personally why it's not important for us to be healthier. And I say that as a question for myself. Right?
Yes, yeah. It's a lot of times we're just so focused as moms on our kids that we're on the back burner.
Yeah, absolutely.
Which is part of this program of how do you put yourself in the forefront, and that's one of the pieces. Is self-care is one of the changes that I felt was necessary in this program, because I come from a home visiting background with the Lake County Healthy Families program, where we focused a lot on self-care and support and taking care of yourself. So I added a piece to this that kind of talked about what is self-care in general. And then I provided the self-care wheel. So if you're not familiar with the self-care wheel, it kind of talks about several aspects of what self-care is. So there's your psychological piece, there's your emotional, your physical, your professional, etc. And looking at each individual piece and what good self-care would look like in those areas, and then having them kind of evaluate, am I doing okay in this area? Or, man, I'm really struggling. I guess I didn't really realize. And how can we make an action plan to implement even just one thing in that area to kind of help you get more towards that life balance? Because self-care is important, but it's so easily put aside.
Yeah, and I think it's important, or at least in my mind, and please correct me if I'm wrong, because I haven't done the research that you have, obviously, but it seems to me that smoking can be very much connected with like stressors, right? So like if we don't have good self-care and our whole aspect of our life, I mean, of course, we're going to have areas that we struggle. That's probably just kind of human nature. But the more we have those struggles, the more likely we are to pick up that cigarette. At least that's what I personally am not somebody who smokes, but I know many people who do. And that seems to kind of be a common theme among them. Like, when I'm stressed out, I smoke more. Or when I'm at work and I just need a break, I go outside and I have a cigarette. Which, if you have a healthy environment at work, maybe you don't need to take that break, or to take that break to have a cigarette, to feel that release of chemicals that kind of help you.
Or even the kind of the environment that we've set up, that if you're a smoker, it's okay to go step out and take a smoke break. But if you're not a smoker, you can't go step outside and just get a breath of fresh air.
Oh, when I was in my 19, early 20s, I used to work at a restaurant. And that was one thing that felt like a punishment.
Yes.
I was like, and not only do you not to get to take that step outside, but then everybody goes outside and you're left managing the whole restaurant.
Absolutely.
It's tough. Yeah.
Yes.
So that is a very interesting dynamic that I noticed early on in my life. And I always thought, well, at some point I finally got to the point where I said, well, I'm going to go take a breather or whatever. And I would just go outside, because I'm just like, man, I want to
go take my healthy breath outside.
Right.
Yes.
So it's definitely integrated. I think it connects to self-care, which is probably why you put that as a piece in this program. That makes a lot of sense.
Mm-hmm. And back to what you were just saying, as far as what you've noticed with situations and emotions and stuff like that, that is a piece of the program as well. And that is in our first session, because you got to identify what's causing you to be triggered in the first place. Because usually when you crave or want a cigarette, it's part nicotine, but it's also part of those other things. So smokefree.gov kind of outlines the 4 different types of triggers. So we've got your emotional ones that are like when you are feeling that you have, maybe you're stressed out, maybe you're anxious, maybe you're excited, bored, but a typical time when you feel a certain emotion and that triggers you to smoke. So whether that's, I'm so stressed out, I need a cigarette, or even sometimes it's happy situations when you're just hanging out, having a good time, and it's a social thing. Patterns. So that is a routine activity that you connect with smoking. So is that like when I'm talking to my friend on the phone, am I smoking a cigarette? Is that when I'm watching TV, drinking coffee? Social settings, when I go to a bar, a certain party, the work breaks. And then also the 4th one is withdrawal. So somebody who's starting to quit, one of the triggers is those withdrawal symptoms, those physical feelings that they're having. So we kind of go through each of those individually and identify specifics to that person. And once we identify those specifics and list them under each area, we create an action plan. So if this is when you're used to smoking or this situation or this emotion, what can you do instead? What's realistic for you? And we give options. We go over things that other people have done or could do, but ideally it's going to be something that you want them to realistically pick that will work for them.
When I was a case manager for a recovery home, one of the things we talked about was, trying to reduce tobacco use, of course, for financial purposes and just for health purposes. And one of those things is that we would try to give tips, but it was always so dependent on the person. So if somebody's listening right now and they're thinking that they'd like to quit, but they're not quite ready to reach out to a resource, what are some those top 3 that you could think of that people use and say it's successful to help reduce their, in a time of need? I remember hearing somebody said, pick up a straw and kind of have that hand-mouth feeling and it might help. Are there any things that you see tend to be effective for people?
Again, every individual is unique, so it depends. If there's someone who is a physical, they're used to having their hands busy and smoking, so what can you do instead? So a lot of times fidget toys work, or holding something else in your hand. Sometimes it's having something in their mouth. So I always recommend chewing gum, whether that's Nicorette gum or not, but just gum in general. And also maybe hard candy, things like that.
Mm-hmm. Yeah, I think those are some of the ones I've heard that have worked in the past when I was working in that recovery home. Candy seems to be a big one.
yeah, for those physical ones. But if it falls into different areas, such as the social or the emotional, it's really what can I go do instead? And there's, it used to be in the old curriculum through Baby Me Tobacco Free, the 5 D's of quitting. So they are just kind of some tips for you to use to be able to remind yourself. It's delay, drink water, distract yourself, and kind of running through those things in your head.
Oh, that's smart. I love the idea of delay and drink water.
Yes. Yeah. Little sips.
Right.
Don't chug. Little sips. Keep your mouth busy. And the delay, okay, I'm going to put it off for 10 minutes. Yeah. Now you get to the 10-minute mark. Okay, 10 more minutes. Mm-hmm. Distract yourself. What can you get up and go do instead? Because you're obviously wanting that. So distract yourself and occupy yourself with something different. Is that going for a walk? Is that taking a shower, reading a book, playing with your kids? Yeah, that's smart. It kind of it triggers your brain to go into a different direction. Mm-hmm. So this is, once again, this program name is Smoke Free Mom. And so it sounds like you do a lot of individual work. So we meet, we talk about where you're at, then we determine what your needs are, how we can kind of avoid smoking. And I appreciate that you've expanded that past 37 weeks because, I think being a recent mom, one of the things is it's hard. Everything is changing, right? Within those during the pregnancy. So I imagine if somebody was used to smoking, taking that away would probably be pretty hard. Yes. Even though we know it's healthier or whatever, we know that. And but that doesn't mean that it's logical in that moment for us, right, to do it. So I can't imagine taking something away when your whole world's already changing. And so now you have the baby and you're okay, I do see that I need to make this change. And now we have a resource. I think that's wonderful that you have created the expansion of that because it's tough. Your whole world is just upside down in that 9 months. Absolutely. And that's part of one of the sessions as well. One of the postnatal sessions is the stresses of parenting because that's going to factor into your smoking. So let's say you've quit, but maybe your emotional trigger was stress before and love our children, but there are those times that it is stressful. Yeah. Especially when you've got kids in the toddler years. Oh, yeah. So how do we manage those stressful situations in parenting to still be able to continue on your smoke-free journey? Yeah, that's wonderful. Mm-hmm. So if somebody wants to get connected with this specific program, what's the step for them? So they could contact us directly. We have a website, mhanwi.org, that has our contact information. Vicki Rainwater is our Lake County smoking cessation specialist, and I am tasked with Region 2. But no matter which one you were to contact, we work side by side together with stuff and continually connect and work on this program together. Our specific Porter County number is 219-462-6267, and we're located at 402 Indiana Avenue at the corner of Indiana and Valparaiso, this cute little white house.
Perfect. So this is free, right?
It is absolutely free.
Nice.
That is the best part. And like I said, you get $25 for each month you are smoke free. So if you were to enroll as a prenatal track client, you can earn up to $200 and postnatal $150 at Walmart.
Wow, that's amazing. I mean, I'm just thinking about diapers right now, and that's like...
Oh, I know.
Help me out.
Yes.
No, that's wonderful. Okay, so that's one of the very many programs that you guys have. Thank you. I'd like to say just thanks, for putting the effort into making sure that didn't get just tossed, right? Like, okay,
yeah.
Baby Me Smoke Free is out, and that's fine. There was reasons for that, but I'm glad that we bridged the gap there. Speaking of bridging the gap, I did not intend to do that, but here we are. I really didn't mean to, guys. Bridging the Gap is another one of your guys' programs. Do you want to talk about that a little bit?
Yeah, so in Porter County, we have a couple programs that are Porter County specific. Bridging the Gap is one of them, and this is a program that we have where we are able to provide emergency assistance to those on mental health medications or those on substance use disorder stuff. So a lot of our clients most of them, I would say, at least 90 to 95% of them are substance use disorder assistance. So we get a lot of our referrals from Porter Stark Recovery. And there are times where life happens and maybe you don't have insurance, or a lot of times what we find is it's not covered and they've got a daily copay. And I have some that daily copay is like $12 a month. So what we do is we take the referral and we are able to identify if we can help this person and provide temporary assistance while also helping them figure out what's a longer term solution, because they will need to get to the point that they're able to provide for themselves. But we understand that's not always easy, but we still want them to be able to have their coverage. So we're able to provide financial assistance there for those who need it.
And that's such a wonderful program. Kind of going back to when I was working in that recovery home, that's one of the referrals I gave, like almost always, to the women I was working with, because, it's possible that they're coming from jail and they don't have employment, or they don't have family members who can support them financially. And so having that assistance to make sure they have the right medications, like you said, mental health as well, and then substance use medications, it's so important, because, I think if we know anything, if somebody's struggling with mental illness, we want to make sure they keep on their medications. Taking somebody off their medications can be like a complete, like, life-altering experience for them, and certainly isn't going to keep them in the frame of mind to be able to get like a job or all those things that you need to have what we, I guess, and I'm air quoting here, deem as successful.
Right.
So that's so important to have that help there. I was so grateful for it when I was a case manager. So, and I've only saw like probably a tiny amount of people that you guys service.
I actually ran into a gentleman at a vendor fair the other day, and it just reminded me the different populations that it could help service, because he was a gentleman looking specifically for services to help veterans that are getting on their feet. And I shared our program because oftentimes we've got veterans who have PTSD or other mental health diagnoses, or maybe even substance use disorder. So while they're trying to get on their feet, that's a program to utilize for us to help.
Absolutely. Oh, it's so great. I just love it.
I know. Me too.
How long do you know how long that program has been It's got to be for
before
at least,
me. It's been quite a while.
Yeah.
I think that and our Open Door Social Club have been the two main programs in Porter County for some time now.
Yeah, and so the Open Door Social Club, now correct me if I'm wrong, and please expand. But my understanding of the Open Door Social Club is somebody who has a mental health diagnosis, they can come and basically attend this like social club where they get to do activities and games and things like that throughout the week.
Yeah, so we've kind of changed the design with it. Post-COVID world, we've all kind of learned and adjusted.
Yeah.
So what we have now, I came on about a year ago and kind of looked at the program and how can we best service our members. So we have structured it into 2 days a week that we meet from noon to 2. Tuesdays and Thursdays is what we're currently doing. And sometimes we adjust that based on the needs of our current clients. But what it is, it's those with moderate to severe mental illnesses who need life skills and social skills. So a lot of times you will find mental health providers who will work more on the therapeutic side of things, group therapy, individual therapy, where this is kind of more laid back. And we talk about social situations that they may have, working on daily life skills, and also just a time for them to get out and communicate with one another. We had a really good session last week where I like to check in once in a while. Tell me one good thing that's going on in your life and tell me one thing that you struggle with. And through that, we find a lot of commonality and shared problems and shared struggles and how that they can help support each other. So Tuesdays is kind of more life skill, social skill based. And then Thursdays are fun days. So in the summer or the spring, if it's nice outside, we try to find things to do in the community in Valpo. But if we're getting into fall, so we've got some pumpkin carving going and we're having a Halloween party and we did caramel apples that we made. Just fun stuff while you're socializing with others.
So if someone's interested in this program, they're here, and this one's specific for Porter County.
Yes, we hope to expand these programs to Lake County at some point, but as of right now, these are Porter County specific, Open Door Social Club and Bridging the Gap.
So if they wanted to get involved, do they call the same number, 219-462-6267?
Yes.
Okay,
yes.
Wonderful.
So if somebody does not answer because we are small over here, please leave a message and I always check the voicemail and I will call you back.
Okay, perfect. And then so for the people who are interested in the Open Door Social Club, what are the parameters for them being able to join? Is there... do they need to have a diagnosis? Do they just need to feel like maybe they need to be in a social club?
They need to have some sort of mental health diagnosis and be treatment compliant. Okay. So that is just for the safety of everybody there, making sure that they have a treatment plan and they are being compliant with it. And when they sign up, we have a membership little packet that they fill out. And one is stating who their doctor is and signing consent that we're able to verify that they are a client and that they are keeping up with treatment. And then it also gives us on file if something were to happen, who we could contact.
Okay, great. Mm-hmm. So you guys take some measures to make sure that safety is a priority, which is, of course, a good idea no matter what programs you're running, right?
Absolutely.
Safety we have to be aware of. I'm sure even with your... with the smoking cessation program, you probably have some things there as well. Do you guys go in-home for that, or is that on your site?
Ideally, we would love to see people in person, but we do have the virtual option because we understand, especially with these moms who've got the younger ones, childcare can be an issue, transportation can be an issue, but we still want to reach you with our program. So yes, there are both options.
Oh, wonderful. Okay, cool. I wasn't even considering virtual, so that's great that you guys have that because... dead on with
yes,
these things are barriers, so that's great. Okay, so I know that we've got those 3 programs going on, but you're also very, very into helping in the community in different ways.
Yes.
So some of the things just here with Help Coalition, this agency that hosts the podcast Matters of Substance, you're involved in our coalition and a couple of our committees over time since the last year. And one of the more recent committees that you've joined is our Marijuana Prevention Committee. And I will say that this is in its infancy and we don't know exactly what our name is going to be yet, but the goal is to address reducing risk of harm to youth and to the community. And so we have a couple ways that we're looking at that right now. But do you want to share a little bit of just by how you're involved with that and just other areas of the community and what you're doing and things you're seeing?
So with the Marijuana Prevention Committee, we were in our hub coalitions. We there was a common thing where we said marijuana legalization might be a thing that is in Indiana's future. We've got Illinois next door. We've got Michigan up north. There's talks about federal things passing. So how do we get ahead of this? How can we possibly look at what the other states are doing and research their successes and failures and how we can help promote keeping our kids safe here or individuals in general, and maybe have something to do with legislation and presenting stuff that we find out or helping shape things of how Indiana's future is going to look if we get to that point.
Yeah, and specifically how we look in Porter County, right?
Right.
We're really working to try and just offset some of those things that we've seen haven't gone so well.
Yes.
And I think we have a good representation. We have law enforcement, which I think is a huge piece for us to have involved in this committee, specifically because if we don't have them, we're going to miss out on that enforcement and what that looks like. You know, what can they enforce? What can't they enforce? What do they feel like is something we don't even need to worry about because it's just unrealistic for them? And so that's really, I think, important for us to know, if we're talking about potency, can they is that something they can enforce? You know, do we want to talk about restrictions on that and how that looks? All of these things are kind of coming up as we talk, and it's a wonderful collaboration of people just trying to figure out what we can do. What change can we make?
Yes, we've got law enforcement, we've got mental health on the committee, we've got substance use.
All of it.
Yes.
Well, not all of it, but we're trying.
It's a lot of different aspects to look at the presented issue to shine light on it and be able to see how we can best move forward. So the law enforcement piece has been huge because a lot of us aren't as familiar with that, and it's been enlightening what I've learned.
Yeah, and if you are listening and you are a resident of Porter County and you want to get involved in this committee, you can reach out to us. You can call up to the office, which is 219-280-5252, or you can reach out to me directly at my email, csamaya@portercountysac.com, if you'd like to join that committee. And it's important to note that we're not, we're not taking the approach of fighting legalization. Not that we, as an agency, we don't believe legalization is a good, safe, healthy option for our community, but we're not taking that approach. We're taking the approach of what do we do if it becomes legalized, and how can we respond to that appropriately so that we're keeping the health of Porter County and our youth specifically safe. So, or at the helm of that. So don't be afraid to if you're not. Wherever you lie on that issue, you are welcome to join us and help mold how we address this moving forward. So, I think we can all agree that youth should not be using marijuana. It's not safe.
Absolutely. So it was kind of, we don't want to just sit and wait around and see what happens. It's how do we get ahead of this?
Exactly. So please reach out if you're interested in joining us on that. And then, Alyssa is involved on our Hub Coalition in Portage. She's involved in our county coalition. And all of that is about, once again, education on substance use, reducing harm. Is there anything in particular that you think is important for us to kind of talk about with what you guys do and how it applies to Porter County and substance use, and how we can how our partnership is important, I guess is what I'm trying to ask.
Really, because as a stance, we are here to support people in our local community, but also because as Mental Health America, mental health has a lot of overlap with substance use disorders. So coming from the standpoint of that, but also with some programs that we have that kind of align with our ability to kind of help with those substance use disorder medications and things like that. So the mental health piece and the substance use disorder piece that we have is what co-aligns with the coalition, and how we, even just being in the community as an organization, how we can best help and support one another to work together.
Yeah, absolutely. And then you guys get, and I don't know how your funding all works, but I know that you can get funding from local communities or agencies. And so with these programs, what steps do you have to take to get like funding? And is there anything that community members listening might need to know about kind of promoting this to make sure that we can continue having access to these programs?
So, yes, Smoke-Free Moms was specifically, we looked and applied to be covered from community partners.
Oh, great.
And they saw the light of our program and they funded us for this year. So this is kind of it was a pre-existing program in a sense, where we took something from something and created something new. So it's our pilot year, but it's not like it's something new that we've been doing. So we'll see how this year goes, and then we would apply for more funding so we can service more people. But we're with grants, it's restricted and it's got specific like where the spending can happen in percentages and whatnot. So we're always looking, I think, for fundraising opportunities, corporate sponsors, donations, things like that, because any of that helps with like the unrestricted funds that can help support the financial aspect of these programs.
Oh, great. And I love that you mentioned the corporate sponsors, because we're lucky here in Porter County specifically. I guess we have a lot of industry throughout the whole county, but we have a lot of agencies that are pretty large. We have a ton of like industry kind of agencies, and then we have a lot of we're a wealthy community, I think, Porter County in general. And so we're very fortunate in that regard. And so it can, if you're listening and you're somebody that's like, I'm a part of an agency that we're looking our corporate world somewhere, I'm trying to find somewhere to kind of make a difference. And I've heard of all these things, but I haven't heard of this. And I feel like this is important, reach out to Alyssa, because I'm sure y'all would be happy to do some kind of corporate sponsorship or fundraising.
Always willing to accept that.
So please do. Wonderful. So is there anything else that you kind of think is important for our listeners to hear or know about that is to do with Mental Health America and WI?
So some other programs I mentioned, we are, Lake County is our early childhood hub for the most part, with the majority of their programs there, but we have been able to transfer some of those into Porter County as well. So we have Parents Village, which is an online private Facebook group that's open to both Lake and County families. And it's just where we post relevant child development information, activities, can do screenings, can do video consultations, share local resources. We also have Infant Safe Sleep, where we have 3 times a month a virtual class where they would attend for about an hour, learn about safe sleep practices, and then afterwards schedule a free brand new Graco pack and play pickup. Nice. So that not only do you know safe sleep practices, you are provided with a safe sleep for your child, or a place for your child to sleep safely. We have Mothers and Babies, which is a 6-week kind of support group. It's a group of mothers who may be having some baby blues or postpartum depression, and can be nice to be around others who are sharing your struggle, knowing that you're not alone. And it's led by 2 facilitators that go over something different each session, and it focuses on healthy behaviors, healthy relationships, healthy thoughts, something to kind of give them some tools in their tool belt while maybe they're waiting to get into some sort of mental health service, because we know there's a wait.
Yeah.
And then we have home visiting programs such as like empowering teens as parents. So that's like dealing with teen parents in the schools and maybe visiting them in the home once in a while, meeting at the school, helping support them be the best parent that they can be in their teen years. And then I'm Somebody Special is one that we just recently got some more funding in, and that is for 3rd grade classes. And we're looking for some more Porter County 3rd grade classes that would be interested in having a presentation, kind of just speaking about self-esteem. And the somebody comes from, everybody's thumbprint is unique and special. So every child is unique and special, and using that aspect with self-esteem and also preventing bullying.
I just feel like if you're a parent, you should just call Mental Health America.
We probably have something for you somewhere, and if not, I probably know somebody who does.
Right. You guys really just cover the whole spectrum of parenthood, it sounds like. And that's wonderful. I mean, and once again, and please, correct me if I'm wrong, this is all free to the community.
Yep.
I mean,
Completely free.
come on. Why wouldn't you?
Yes. We have tons of stuff.
Yeah, that's wonderful. And, I think you hit on, you're talking prenatal, you're talking postnatal, you're talking teens, you're talking third grade, so it's kind of like in that middle range. You guys are really working to just look at the health of the mother and the child. And I assume the father as well, can receive services to some of these as well.
Absolutely. Dads are always welcome. Wherever we can get dads to fit in anything, we are more than happy to have them involved.
Perfect. So, you guys are really just all about the fam.
Absolutely. Yes.
I love it.
Because, our society starts with the family.
Yeah. And I think sometimes we lose sight of that, not intentionally, but, the world is very busy. Our worlds are very busy typically, and it's hard to...
Sometimes you're just on autopilot getting through the day.
Yeah, like, oh, okay, I have to, it's homework time now, and bath time and food, and now the day's over. Yeah.
Yes.
It can get really, I don't want to say overwhelmed, but busy. It can be so busy. And so I think kind of getting back to those basics and having people who will partner alongside you and remind you of the importance of those basics is necessary.
Yes.
And if you don't know, you probably do if you've listened before, because I feel like I mention this all the time. But, having that healthy connection with your family and spending time with your kids, that is a form of prevention from substance use. And so
Absolutely.
Take the opportunity to learn the skills and get some of these great resources. Gift cards, pack and plays. Those are important.
Yes. And the Mothers and Babies program actually has, I think you can earn a $30 gift card for completing the 6-week session. So
nice. 6 weeks, it helps you understand how to be the best parent you can be.
Then go take your $30 and go buy yourself something for self-care.
Yeah.
Treat yourself.
Right. Let's get some nail polish, a face mask. Feel
Something.
good.
Yeah. Yes.
Well, thank you so much, Alyssa, for joining us today. Before we end out, I do want to do one more just kind of plug of where people can reach you. So we have the phone number, which is for the Valparaiso office. It's 219-462-6267. And then if you're interested in getting connected virtually, you can go to mhanwi.org. And that is for the smoke-free moms, if you want to connect to that one.
Yeah, you could call either number.
Okay.
If somebody answers, they will connect you to who you need to connect to. So
Perfect. So, thanks for joining us today. I very much appreciate it. And I hope that those listening, if you aren't a parent right now or you're a parent of an adult, spread the word. Let people know. This is for everybody in the community. And so we just need to let people be aware, right?
yes, we are here, and feel free to contact us. And like I said, if we don't have it, I can find somebody who does.
Yes, I love it. Well, thank you so much.
Thank you.